Often these are people who haven't received the type of healthcare that they've deserved throughout their life. And so this is like, it dignifies the experience of care. It dignifies the experience of aging that I don't think you always see across the board.
This is the Visible Voices podcast. I'm Dr. Resa Lewis, emergency medicine and lifestyle medicine physician, medical educator, and your host. If you're new, welcome. This show is about making healthcare equitable, one visible voice at a time. Today, I'm joined by Evan Jackson, co-founder and chief revenue officer of Intus Care. He and his co-founders founded Intus Care while in college, and what they built sits at one of the most overlooked intersections in American healthcare: aging, equity, and technology. Intus Care is purpose-built for something called PACE, Programs of All-Inclusive Care for the Elderly. Intus Care now serves more than 70 PACE organizations, supporting more than 50,000 participants, and has raised over $50 million in funding. Evan Jackson, welcome to the Visible Voices podcast.
Well, thank you so much, Resa, for that wonderful introduction. And it's great to be here alongside a fellow Brown alum.
In simple terms, what is PACE?
PACE is an all-inclusive care program. The PACE model revolves around a day center. So people are transported in each day where they have an opportunity to socialize with people through the recreation services. They also have a full interdisciplinary care team who's on staff at that day center. So everything from your PCP to your RN to your social worker to your dietitian, they're all there in the center. So when you're coming into the center, not only are you socializing, but you're receiving all these healthcare services. PACE is a Medicare and Medicaid plan. So most people are dual eligible. They receive a check from both Medicare and Medicaid each month to cover all of your expenses. So whether you're receiving care in the day center or you have an acute visit and you have to go to the hospital for some reason, PACE is responsible for paying that bill. Most people pay $0 out of pocket for PACE.
It's been designated as dual eligibility. What does dual eligibility mean? And if someone is not dually eligible, like say someone has Blue Cross Blue Shield Plus, are they eligible for these types of services and care with PACE?
Dual eligible effectively means you are both on Medicare, so you're an older adult, and on Medicaid. So you qualify for Medicaid through lower income. And so these duals are members of both of those plans. For PACE, if you're above 55 years old and nursing home eligible, you are eligible for the PACE program, even if you aren't a dual on Medicare and Medicaid. If you are a dual, you don't have to pay any expenses for the PACE program, which is beautiful. If you're on one or the other, you may have a small out-of-pocket expense, but that's how the model works. We see typically just above 90% of people within PACE programs are duals. But again, it's really special care. So even some of those people who maybe are just on Medicare or just on Medicaid, we do see participate in the program.
What does Intus Care solve?
Yeah, so we solve their technology problem. So when we entered into the PACE world, and I guess I'll take it a step back, our junior year at Brown, we decided to leave school to go work full time in PACE programs. We lived in Robbie's mom's basement. We would go into the PACE program with her each day and learn and serve wherever we could. And very quickly, we realized that PACE has a technology problem. The technology was very outdated. They had limited insights when it came to their participants' trends and care status. And so we started recognizing that very early. So the first problem that we started tackling was that data challenge. Again, PACE is fully at risk for the services they provide. So it's very important for them to have good information and data to make sure they're being proactive and preventative in the care that they're providing. When we started in PACE, a lot of things were being done on Excel spreadsheets. It was very difficult to get the data out of the EMR. So we wanted to pull their information in an automated way and display the key insights that they needed to know. So while they were in their interdisciplinary care meetings, they had the information to drive the best care outcome. So that's really where we started, but it's not where we ended because they have a full tech stack that was really holding them back as opposed to pushing PACE forward. And so from there, we ended up building risk adjustment technology to help them better capture conditions, which also leverages AI. We ended up building out their electronic medical record, which is now our leading offering that allows us to not only store and help them document all the data, but it allows us to provide care management and data-driven insights right at the point of documentation so they can really leverage that information to provide the best care. And then lastly, we do have a team of clinical professionals on staff who help our programs through consulting. They help them manage their utilization and also help the program make sure that they stay in compliance.
Most of us are familiar with Epic or with Cerner that are in the clinical medicine world. Where is AI playing a role?
AI plays a role in everything now. And I think healthcare is such a unique AI space, because I think getting things right is really important and process is very important. And we're embedding AI directly in our tools, whether that's leveraging it to better surface clinical insights for participants, whether it's, servicing prospective diagnoses codes to make sure that they're capturing all that information, or even thinking about ways that we can leverage AI for compliance purposes to pull and identify when something may not be documented correctly that is going to lead to a CMS ding later on. So those are some of the areas that we leverage AI in the tool to help drive the right conversations for the team members. And then internally, of course, we're leveraging AI quite a bit. I think that these tools are coming a long way and they're helping us operate more efficiently, which in turn allows us to build things more swiftly to benefit our end clients.
And in terms of your client and the people or the institution to whom you're selling the product or integrating the product, is it PACE programs only? Is it also private physician offices? Is it academic medical centers, federally qualified health centers? And who are you serving?
That's a great question. So today, predominantly, we serve the PACE community. That said, PACE sits in a really interesting position in healthcare where most of these PACE organizations are owned and operated by either FQHCs, hospice organizations, or other companies that are really designed to take care of our most complex senior populations. And that's really where we see ourselves sitting.
In the small town in which I grew up, there's a senior citizen center. What would be the compare contrast of a senior citizen center from a PACE center?
For that senior center in your home, are people living there? Is it a senior living environment, or are people coming?
It's day only.
Yeah.
Meals are provided. A lot of programming that's social in nature, some education in nature, but there's no healthcare being provided.
I think there's a few key differences. Number one, the heartbeat of the PACE program is the interdisciplinary care team. And I think that's very unique to PACE in terms of its size and scope. PACE programs are required by law to have full interdisciplinary care teams. And I named a few of those disciplines, but I want to say there's 12 or 13 different disciplines that they're required to have on staff in the center. So when you go, yes, it's very like you're getting the social aspect of things. You're seeing your friends, you're having fun, but at the same time, it's your one-stop shop for all of your care. Again, like everything from your PCP to your social worker, to your dietitian, to your rec therapist, OT, like you're getting this comprehensive suite of services, which I think in healthcare convenience is an important part of how we think about receiving accessible healthcare, and PACE programs allow you to do that right when you go into the center. So I think that's one thing that's really special and unique. I think secondly, the payment model is very unique. 90% plus of PACE participants aren't paying anything out of pocket for the services that they receive. And it's really special going into a PACE program and seeing that. These are beautiful centers with amazing care. And again, like given that most of the individuals are also on Medicaid, often these are people who haven't received the type of healthcare that they've deserved throughout their life. And so this is like, it dignifies the experience of care. It dignifies the experience of aging that I don't think you always see across the board.
100%. How do people who are listening, they're like, oh my gosh, I've never even heard of this. Is there a PACE program in my area? How do people start searching and learning?
They say PACE is the best kept secret, but I don't want it to be a secret. I want people to know what they can access. And again, it's such a special model of care. The first place I'd recommend going is to the National PACE Association website. They're also referred to as the NPA for short. They have a list of all the PACE programs. And one of my favorite parts about that website is that they have an interactive map where you can go into your city, to your county, down to your area, your zip code, and see which PACE programs are around and where you might be eligible to enroll into a PACE program. And it's very easy to get in touch through a phone call with these organizations, and they'll very swiftly start discussing with you your eligibility.
Should people be able to find out this information also perhaps through the primary care physician or through the Chamber of Commerce?
They absolutely should be, though that's not always the case. And I think people are now starting to learn more about PACE, but I think even physicians, to your example, may not know about PACE and whether it's the right option. So I think the National PACE Association is the right place to start. That said, I do recommend that people consult their physicians and trusted care partners, because once they learn about PACE, it starts to click and they're able to help recommend whether it may be the right option or not.
How are you and your company and your team, how are you getting paid?
We get paid on a per member per month basis. So per patient is how we get paid. As an organization grows, they pay us additional per patient per month. And I think for us, that really incentivizes us to think about how we can help our customers scale efficiently and effectively while delivering the best care. I think when we think about our core value areas, like we help programs provide incredible care, save cost, and optimize revenue. So really helping these organizations scale.
And since they're not private organizations, is the per patient, charge, is that coming through federal funds or state funds?
Yeah.
Both?
Yeah. So basically the way the funds flow is every month the PACE they receive funding. They receive a check from Medicare on one side and Medicaid on the other side. Typically that looks anywhere between, $8,000 to $12,000 per month per patient. And then that funding is what the PACE program uses to cover everything. Again, whether that's paying their internal staff, paying the day center costs, paying for your external claims, and paying for things like the software like us that they need to support. So from that large pot of funding, it goes down through the PACE program to us to pay for their software on a per member per month basis. Also, given that this is the way that PACE programs are paid, the economics make sense.
Where are you and where are PACE programs with like wearables, maybe like a portable pulse ox, or maybe, like a wearable ring or wearable watch to look at sleep health?
In the past month or two, I've probably had 4 or 5 conversations with different players who are now starting to support PACE programs, which is really exciting to see. I think that the most innovative programs are thinking deeply about where they can leverage wearables, especially those that are rural PACE programs that may have more challenges getting people to the day center because maybe the participants are an hour away as opposed to 15 minutes away. They're thinking deeply about wearables. I think the biggest piece of the pie that they're trying to crack is how do we now receive information from these wearables in a consolidated way that allows us to drive actions? And I think that's where IntusCare comes to play. We don't build or provide wearables, but we are the core place that they're looking at to receive their insights and data. So our conversations with the different wearables and remote patient monitoring platforms is how can we pull this information in so that PACE clinicians are looking at the same information, are looking at the same platform for their source of information.
And who's generally receiving the data and the reports or looking at the patterns where a flag could be raised?
Typically, these programs are meeting daily in their interdisciplinary team meetings. And when we see the tool work at its best, they're actually pulling up the insights and information as they're all sitting there discussing participant by participant to say, hey, here's John Smith's profile or here's his risk trend line according to Intus. Have we talked about the fact that his risk continues to go up and we haven't put into place an intervention that can actually change the course of this individual's life? So that's typically where the conversation is had. And then ideally, this is cascading into changes to care plans, new interventions, new care management strategies that the team can now implement because of the information they've received.
Lifestyle medicine and sort of intentional actions and behaviors are important for the prevention, reversal, and treatment of all the chronic diseases that are plaguing Americans. Obesity, cancer, cardiovascular disease, cerebrovascular disease, and on and on. Where is Intus Care playing a role with these lifestyle behaviors?
Food is such a big part of healthcare. And all of these PACE programs either contract with an organization to provide meals in the day center or they're actually cooking in the day center. They do have full kitchens. And I've been seeing a trend that's really interesting where I think people are looking for more from these partners and starting to seek out people in the space who are going to bring both the science aspect to the way we think about food. And so I do see the needle changing. For us, we don't do much within that space, but I am seeing a desire for more because I think, again, to your point on the theme of preventative care, this is a big lever to pull, right? We want to make sure that we're getting in front of any adverse outcomes, and food is one of the first places that people look.
Flags and elderly in terms of falls, urinary tract infections. Another is dementia and dementia care. And there's a lot of attention happening right now in our country regarding prevention care and even treatment. There's something called the MINDS diet. Where have you seen that in the PACE programming?
Dementia is always a focus area. I think even outside of PACE, we're seeing models like the GUIDE program come up that are specifically designed to meet the needs of dementia participants or dementia patients. For us, I think the way we think about it is as a piece of the pie when we think about the overall risk for a patient. So it's really important for us to consider and provide insights as to how dementia is uniquely impacting this individual, where maybe if they have all the other conditions or all the other indicators that they have without dementia, they're a different level of risk. I think one of the beauties of the PACE program is that you're seeing individuals every day, as opposed to a health plan where maybe you're, handling the financial piece, but you're seeing the patient once every several months. And I think that's a really important way that PACE programs are able to get in front of any dementia related risk. We are seeing PACE programs that are building specific parts of their centers to meet the needs of dementia patients and giving them quiet spaces that are going to be constructive to them having great days each day.
It seems like there's an expectation/assumption regarding PACE centers that there's access in terms of proximity, transportation. You mentioned rural. Like, what have been some of the solutions you've seen for people that are more remotely located or, say, can't afford and don't have access, can no longer take public transportation?
So I think one of the special things about PACE is they are required to have full transportation teams on staff. So the PACE program is actually the entity that's responsible for picking you up, bringing you into the center, which I think is a really powerful piece, again, to the point of access and ease of accessing healthcare. That said, rural PACE programs are very different than urban PACE programs, especially in how dispersed their participants are across their service areas. And so we see those organizations implementing slightly different approaches than maybe the urban programs may, where the urban programs can rely more heavily on the day center. We see the rural PACE programs that are becoming more innovative when it comes to remote patient monitoring, identifying when they need the participant to come to the center as opposed to having them come in each and every time. There's also requirements in PACE that a participant can only ride in a bus for so long. So if you have one participant who's over here and another participant who's over there, you may have to pick up one and then bring that individual back before going to get the other. And so I think that's a limiting factor for rural PACE programs. But, with constraints comes innovation. And we're seeing programs become very innovative when they think about leveraging RPM and the day center.
I'm interested in you and anything that you've started doing or behaviors you've changed based on seeing PACE and working with elderly in terms of your own health span over lifespan.
I think number one is the way I eat, the way I take care of myself, I think has become even more important. So the way I think about my own health, of course, alongside working out. I do think a couple of things that have really changed are the way I think about socialization and mental stimulation, like doing little things every day, like the crossword puzzle, engaging my brain in different ways, making it spend time reading my, fictional book, things that are going to continue to engage my mind.
What would be one food or drink substitution, one swap? I'll give you one I did.
Yeah.
So I stopped using oat milk in my coffee and I just drink black coffee. That'll be one.
I actually recently stopped drinking coffee in exchange for tea.
Mm-hmm.
Yeah. Because
Gotcha.
I need my caffeine some way or another. But I found, it's so easy to slip into the caffeine 5 cups of coffee a day, which is where I was headed. And I was like, where it started, I feel like really impacted me was my sleep. And that's another area that I've tried to be more intentional than I have before, even as I think about my own longevity. And, as much as I love coffee, I found it was getting in the way of that. So that's one thing I swapped recently.
If we don't sleep well and get at least 7 hours, it actually puts us more at risk for dementia.
Absolutely.
What's it been like to work with physicians? How are doctors?
We love our physicians. We love the work there. I think it's so interesting because I think the reasons that doctors get into this space, I think help to inform how we interact and work with them. And I think at the end of the day, 99% of physicians are in it because they want to provide good care for patients. And I think that what I find is that physicians find the right process, the right step-by-step to do that. And that's what they're looking to do. And once they find that formula that works, they want to stick to it. And so I think the challenge for us has become change management. How do we think about working with physicians where we see there may potentially be a better or more efficient way? How do we work with them to get there, even though their current process may be working in some way, shape, or form? And I think for us, it's always important to realize the significance and high risk nature of what they're doing. These are real patient lives that are on the line. And so they're going to do whatever it takes to provide the most high quality care there. So it's about us working with them, partnering with them. And I think physicians are very sharp individuals. It's about helping them see why this is better, as opposed to saying, hey, this is just something that you need to do or change.
There's so much that I just read in this response because I imagine that there's tension because you and team are not physicians. And often physicians are like, well, you're not a physician. You didn't go to medical school. And there can be ego. There can be narcissism. There can be I'm the smartest person in the world. Someone said to me once, This is an MBA who worked with a lot of physicians. She said, Resa, physicians often think they're the smartest people in the room. And so I share that respectfully, saying that just I could imagine that maybe at times it can be challenging, or you might get resistance or pushback, especially because things in healthcare are so slow to change. There's often that we've always done it this way, so why would we change?
It can very much be difficult and it can be an uphill battle. At the same time, it's so important because oftentimes there's some of the leaders on that interdisciplinary team. So as they do, others follow. I think one of the most important things we did early on was we brought on our chief population health officer, Laura Ferreira, who is a nurse by training and also had experience leading as the CEO of one of the largest or fastest growing PACE programs in the country. And so I think that helped to level set the clinical conversation, at least to give us the in for them to receive the information that we needed to share, as opposed to putting up walls before we could even get started. So I do think that was really important for us to be able to have these eye to eye trusting conversations.
Evan, when did you realize you had a voice and when did you start using your voice?
It feels like, honestly, even more recently, we've been working on the business for, almost 7 years now. And I think for the majority of that life cycle, while I was learning so much, I didn't yet see myself as a true expert. And I think in some ways that's probably self-imposed, right? I think you grow up and see people doing X, Y, and Z, and you think only if I have more and more and more information, then I'll really be able to use my voice. I think in reality, there were probably opportunities for me to use my voice even more before. But I do think at this point in time, it feels like there's a very unique set of information and knowledge that I've gleaned. And I've really been trying to lean into my individual experiences because no one's more of an expert in my experiences than me, and not letting any sort of imposter syndrome hold me back from using my voice.
What's so beautiful about the model of you and the team and Intus Care is like you have a very focused community and you're answering a very focused need. There are generalists in the world. There are specialists in the world. And what strikes me is you and team are specialists. You have this population. You identified a need. You identified an organization. It's so specific and it's been so successful.
It's so funny. I think even taking it back to your last question, the first thing I had to do to use my voice was learn how to use my ears. And I think that's one of the things that our company has been just uniquely really strong in. And I think when working in a specialized industry, so often they're used to experiences where they have to retrofit things that are made for the broader market to their specialized workflows. And we took the opposite approach that I think built community in a very special way because we're building for those specialists as opposed to retrofitting something from the broader market, which I think very much resonated. And what was important for us in that is, again, listening very intently to their challenges, learning them, and then building what they needed. So I think that's how I see it. For us, I love building in a specialized industry. I think it allows us to be laser focused on solving problems, and that's what we love to do. I don't want to solve a million problems for a million people, but if I can take this group and really deeply understand, solve, and make a difference for them, then I feel fulfilled.
As I bring our conversation to a close, I'd love to leave the audience with microskills. So, small intentional actions they can take for the listeners that want to really access PACE programming for themselves or for family members or friends. How do you logistically set something like that up?
Mm.
What would be a first step?
The first step, again, is finding your local PACE program on the MPA website. The PACE program can only service you if you're in their service area. So I think that's an important first step in terms of awareness. And then visit their website. Those PACE programs have a phone number on their website, and I guarantee you they will answer and be able to direct you into their process, which typically starts with an eligibility assessment to see if you qualify. But those programs are going to help you step by step to learn everything you need to get enrolled in the PACE program.
For our physicians and other healthcare professionals listening, they're like, whoa, I knew nothing about PACE programming and that there were so many resources for the elders for whom I care in my professional practice. What's one thing you hope they take from our conversation? And what's one thing they can do to better serve their elders?
I hope one thing that they take from our conversation is that PACE program is a real viable option for many of their patients. And it's a very important care model when they think about delivering the highest quality care and highest quality of life for the patients who they love and serve. I hope they take away that it's worthwhile researching and learning so that they can leverage PACE as a tool in their arsenal when thinking about care management strategies. So I think that's first and foremost. In terms of actions that I hope they take, I hope they go and learn. At this point in time, it's a very different environment than when we started 7 years ago. And there's quite a few resources and information online about PACE. Again, the National PACE Association is a good place to start. Within our website, within our LinkedIn, we do provide a newsletter providing information about the PACE market and industry insights. I do recommend that people subscribe to that and take a look at that. But it starts with learning. Physicians love to learn, and I hope that they use this as an opportunity to learn about PACE.
We do love to learn. And I would be remiss if I didn't ask, has PACE programming been affected by some of the changes in healthcare through the government, the Affordable Care Act, et cetera?
Some. I think it's really state by state specific, especially on the Medicaid side. That said, this administration has been putting a high emphasis on PACE. Actually, many PACE programs across the country and organizations like ourselves have spent time with CMS and CMMI around how they think or how we think about the PACE model expansion. And so we are seeing a desired interest in pushing PACE forward.
Evan Jackson, thank you so much for joining me on the Visible Voices podcast.
Awesome. Thank you so much, Resa. It's been a pleasure.
The Visible Voices podcast amplifies voices in the healthcare, equity, and innovation spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis, MD on social media or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by hosts and guests are their own and do not reflect those of their employers or institutions. Guest appearances do not imply endorsement of any product, service, or organization. Information shared here is intended for general informational purposes only, reflects the time of recording, and should never substitute for clinical judgment or individualized medical advice. No physician-patient relationship is created by listening to or watching this podcast. Together, we're making healthcare more equitable, one visible voice at a time.